you, Dr. Shaik. Thanks for being here tonight. It's good to see you.
All right. Thank you all for coming. We'll go ahead and get started just for the sake of time. Looks like it's 7 now. Vanessa, please get away.
Alrighty, good evening, everyone. Thank you so much for joining us for tonight's DEIA resident panel, an event made possible through our collaboration with Representation in Rehab. Their support has been instrumental in bringing us together to learn, connect, and share insights on the critical topic of diversity, equity, inclusion, and advocacy in physical medicine and rehab residency programs. We are super excited to have a fantastic panel of residents from across the country, each bringing a unique perspective on how DEIA initiatives have influenced their residency experiences. Hearing directly from these incredible residents will be invaluable for all of us students, as they can provide us with firsthand insight into how programs support diverse backgrounds and foster inclusive environments. Their experiences reflect the progress we're making, but also highlight areas for continued growth. We also want to recognize OSU Comms chapter for sponsoring this event. Thank you all for being here. And we're grateful to share this time with you. Rhoda and I are going to be your student hosts for tonight, so we will begin with introducing all of our panelists.
Yes, thank you so much, Vanessa. I'm just going to go down and give a little bit of information about all of our panelists. We did get a notification that Dr. Tiffany Wood was on a late shift and she had a late admit, so she might be popping in late, but just wanted to preface with that. So first we have Dr. Luis Valdez. He is a PGY2 at UT Health San Antonio and is the current president of Representation Rehab. So thank you for the collab. As a medical student at McGovern Medical School, he was the co-director of the Latino Medical Student Association, or LMSA, for the Southwest region, which included 20 LMSA chapters in 6 different states. And during his intern year, he also served as the chair of PM&R Scholars Medical Spanish Network. Next, we have Dr. Raquel Johnson. She is a PGY2 at the University of Missouri and is currently a research resident leader for Representation and Rehab, and she completed her medical school at Southern Illinois University School of Medicine. Thank you, Dr. Johnson. Next, we have Dr. Chandan Saini. He is a PGY2 at Rush University and serves as the current vice president of Representation and Rehab. And is on the AAP social media committee. He completed his medical school at Midwestern University Chicago College of Osteopathic Medicine. Next, we have Dr. Sameerah Shaik. She's a PGY1 at Northwell Health Peconic Bay. Dr. Shaik is a member of the AOCPMR Residence Council Diversity Program Committee and is a social media coordinator for PM&R Scholars Medical Student Network. Spanish Network, I'm sorry. She completed medical school at William Carey University College of Osteopathic Medicine. And then lastly, we have Dr. Tiffany Wood. She is a PGY2 at the University of Michigan and is a vice president of the AOCPMR Resident Council, and she completed her medical school at Alabama College of Osteopathic Medicine. So clearly we have a great lineup of panelists, and we're so grateful for their time this evening. And yeah, I'll hand it off to Vanessa.
Thank you so much for introducing everyone. And for our students here, y'all are welcome to turn on your camera if you'd like. We want to make this interactive and engaging for everybody. We want to give each of our panelists a chance to tell us about their roots, what this topic means to them, and also their involvement with either AOCPMR or Representation in Rehab. So maybe we can start with Luis, and he can tell us about himself and a little bit more about Representation in Rehab.
Yeah, hi everyone. Thank you so much for having us. Thank you out to our student host as well for hosting this event. So yeah, like they mentioned, I'm a resident here in San Antonio. Wait, this light is like really killing the vibe. Let me set a better mood here. But yeah, I'm born and raised in Mexico in the Baja Peninsula, about 2 hours away from San Diego. I moved to the United States, to San Antonio specifically, when I was in high school when I was 12, near high school. Stayed in Texas for basically most of my life here. Went to Austin, then Houston, then back home here in San Antonio. So that was kind of my upbringing. Being Hispanic, I'm also I identify as a first generation student. My mother didn't get to do like complete middle school training, and my dad didn't get to finish elementary school training when they were in Mexico. So I was the first to like graduate high school, college, medical school, so on and so forth. So that's been really rewarding. Diversity means a lot to me because I know I've seen it at play in the clinical setting while I was a medical student, even as a pre-medical student, doing rotations and going to different areas that were underserved. I saw how important it is to, see yourself in the population that you're serving and how that would manage or manifest as providing better care for those patients. So I was even early on when I didn't know what specialty I wanted to do, I knew that regardless of whatever specialty I decided to choose, I would want to be involved in like that diversity aspect of that and trying to make it more and more diverse. And that's something that I think really speaks to all of us here in this virtual room. We want to see diversity and improve diversity in rehab because you know that can make the care that we provide for our patients even better.
Dr. Johnson, would you like to go next?
Absolutely. So hi everybody, my name is Raquel Johnson. I am from Inglewood, California, which is a suburb of Los Angeles. I have been blessed to live all over the country. I ended up getting a scholarship and going to college out in New Hampshire, and then decided to do my medical training in Illinois, and now I'm at the University of Missouri, so every time zone, and I've gotten to see kind of how things work all over the country. And in terms of diversity and inclusion, it's, sorry to say, almost the same story wherever you go. There are so many cultures and so many different ways of living here in America, and they're not always represented in medicine. And things do get lost in translation so often. And I think that having a meeting about something like this, about diversity and inclusion, especially when we're dealing with rehab, which is something that literally everybody's going to need at some point in their life. I think it's an important topic. I think they go hand in hand, just because culturally speaking, it's going to be different for every single patient. Even if these are two people from the same place, if they're two people from different corners of the country, if they're from different countries, I think it's important that a rehab physician kind of knows what they're looking at, or knows where they can turn if they don't know what they're looking at in terms of making their patients feel included in the care that they're giving.
Thanks for that. Dr. Saini, would you like to go next?
Yeah, definitely. My name is Chandan. I'm a PGY2 at Rush, and originally born and raised in Phoenix, Arizona. There's a big Latin American Spanish-speaking population over there. I actually took 8 years of Spanish growing up, and at one point I knew Spanish better than my own mother language, Punjabi. Now it's kind of reversed because I haven't practiced Spanish as much. But I got to kind of be really involved in the homeless population in Arizona, but also kind of the Latin American population there. And then I did a gap year in New York doing research at Hospital for Special Surgeries, and New York just being a huge mecca of different cultures and a huge hodgepodge and mix of people from different backgrounds. And now I'm in Chicago. I'm gonna echo a lot of what Luis and Raquel said. Diversity is everywhere around us, especially in medicine, whether we're providers or even from the patient population standpoint, from a provider standpoint. Within rehab, we work with interdisciplinary teams, PT, OTs, and then I think just it's a big collaboration field. And I think the more people from different backgrounds, the better ideas, the better, just better inclusivity of care we can provide to patients. And then when it comes to patients, it's just I think it's important to also expose yourself to patients from different backgrounds to then be able to understand and learn how to kind of navigate in certain scenarios or dilemmas, and then it'll only help you as a provider to then help the patient again at the end of the day.
And Dr. Shaik?
Hey everyone, I'm Sameerah. Thanks so much for having this event. I think like representation is something that's super important, kind of based on like what everyone else has said so far. It's something that's super important in like all of the specialties that you go into. Just a little bit about me. I was born in India, but I came to America when I was about like 3 or 4 years old. So pretty much like grew up here. I am from New York, so a very diverse state. I did most of my training and everything in New York. And I think it gives you a lot of appreciation for the culture and learning from all the different cultures around here. In college, I majored in Spanish. I've always been interested in Spanish, and I think even in like I guess like clinical setting or non-clinical setting, when you're talking with people and like a language that's comfortable for them, I think it gives that sense of like comfort and breeds that familiarity. It kind of creates this like underlying like rapport. It's something that's hard to get when it's like there's a language barrier or someone's not as comfortable. There's oftentimes like I remember one time on my peds rehab rotation, one of the patients, she speaks Hindi, and she wasn't really understanding what like my attending was saying. I think there was a language barrier from the attending and the patient as well. So I kind of was able to help like provide that middle ground and kind of translate for them. And I think it just goes to show that like the more like educated you are about like the different cultures around you, and kind of help them and the help patients or even like attendings like in those like situations, it kind of helps overall. But in general, I think we can all do our part when it comes to diversity, right? I think there's always like areas for improvement. I went to Mississippi for medical school for my 2 years there, and then I went to Queens for my clinical rotations. And when I was in Mississippi, I obviously wasn't as like diverse, and it gives you a different perspective on life, right? Like you see why diversity is important. And a lot of the people there weren't really like exposed to many of the cultures. So I think like just doing your part, like wherever you go, because in medicine, you're going to go to different places. Sometimes you're not always in the same area. So I think kind of taking wherever you go, it makes a big dent, I guess, in the grand scheme of things.
That's incredible. Thank you all so much for sharing a little bit about your background and your journey. And also thank you, Dr. Lewis, for doing this on your call shift. Just wanted to shout that out as well. So now we're going to get into some more specific questions that we wanted to address, and we'll direct these generally to the panel. So whoever, if one or two of y'all are able to answer each question, that would be great, just so we're not, picking and choosing. So whoever's most confident about each question, I guess. So the first one we have is, does your program have specific initiatives or support system for residents from underrepresented backgrounds? And if you have examples, please share.
I'm happy to start us off with this first question. For our specific program, so we obviously the UT Health San Antonio is like a big academic center, so our department falls under the big umbrella of UT Health. And here in San Antonio, we do have a program called Circles of Care that is a residency-wide initiative for all the different specialties, where they basically provide free services. It's like for mental health and things like that, but they also take a little bit on that role of trying to give exposure and help individuals who need more help with like their transition over to residency for whatever reason it may be. So that's something that they introduced very early on during like our orientation here. And they recommend in PM&R specifically, we've been really good. Our chief residents have been really good about encouraging us to at least attend a couple sessions just to get a sense of what those sessions look like. And then from there, you can always schedule more, schedule less based on what your needs are. And the people that we work with here at the Circles of Care program are phenomenal. They're very welcoming and open, and everything is very confidential. They create a very good safe space. Also through the medical school, they have a program. They because it's Texas, we had a Office of Diversity and Inclusion through our medical school, just like many other medical schools here in Texas that I know have. It has been rebranded, reworked into the Office of I think it's like academic excellence and equal opportunity and academic excellence or something like that. So just kind of like move some letters around, but the statement that they're trying to make and the help that they're trying to make, it's still there. I actually just attended an event last week. It was a lunch that they did, luncheon with medical students and residents and faculty, and it was called the First and Family event. So it was like for first generation students to come and share their experiences over lunch and receive a little bit of mentorship and things like that. So I think those are like two very good initiatives that I really applaud my program and the system as a whole for having in place, because it helps with that transition while you're in residency, which we know can be pretty tough.
Yeah, I can speak about for Rush at our program. We have a pretty big office of DEI, and they often host like mixes or events, like a beach day, every couple months, just to kind of bring people together and just bond, mingle, and just get to know each other. And I think there's like a certain value in terms of just meeting strangers from just different backgrounds, who then just become your friends. But I do kind of appreciate that about our program here. And then also, like Rush has a lot of good resources where if you even on like, open up your own kind of club for a certain backgrounds, it's very easy to do that and then promote certain things. And they're very flexible, like on religious holidays, in terms of trying to promote DEI for almost everyone there, from all across the employees and staffs. They do a good job.
I can speak about Northwell Health. So kind of similar to like other programs, it's like an umbrella organization. So since it's part of a larger health system, there are a lot more resources available for DEI. I think last month, I think the CEO essentially sent out an email celebrating like the Global Diversity Awareness Month. They always have like different events or mixers or programs going on. I think last month they did something to celebrate like Diwali. I thought that was really nice. I think each hospital has their own thing. I think from our program specifically, we have like a cultural day, which I think is really nice. So instead of like a wellness day or anything like that, whether it's if you want to take it off for Christmas or if it's for something else, like you can kind of choose whichever day is more significant for you to take that cultural day. So I think that's really nice. I hadn't really come across that when I was interviewing at other programs as much. Usually it's like wellness days, but this is like separate from the wellness days and vacation. So that was really nice.
Guess that means I'm up next. So usually at Mizzou, our rehab hospital is separate from the actual university and like the main hospital campus. And our rehab hospital is called Rusk. So typically at Rusk, every month we are identifying a different population that's considered to be like not as common or not as prevalent. So just this past October, actually, I believe was Hispanic Heritage Month. And so we're very tied into food at Rusk. We have like a really great staff cooking for us. And so we had every Wednesday, we would have a different kind of like Hispanic heritage food. We've had people come and play music, or sing songs for us. We have different events that the patients can participate in, depending on what month it is, obviously. And then, the next month we get to highlight a different kind of culture. So, I mean, obviously we're also part of like that great D&I or DEI umbrella that's in the University of Missouri, but at Rusk, you get to actually, I don't know, it feels more individualized and a little bit more special that you get to share that not just with your colleagues, but also with the patient population. So I think it's a good time.
Awesome. That's great to hear how you guys have been able to experience those types of events and stuff. Our next question is, are there residents or faculty from underrepresented groups in leadership or teaching positions within your program? And how do those leaders contribute to a more inclusive environment?
I can start off this one. So at Mizzou, one of our our stroke attending is Dr. Vivanti Jones. She's also the president of the African American PM&R Association currently, and she goes out of her way not only to establish events for underrepresented communities, but also to incorporate folks who would be considered disabled into those things. So not just race and ethnicity, but also varying levels of ability. So recently, I believe this was in September, we had what's called Tri-Para Sports Day, which I thought was super cool, where the DASA community, which is they do para sports like for children, like wheelchair basketball and bocce ball and things like that. They bring the materials that you would need to play these various sports, like, oh, if you're going to play power wheelchair soccer, they brought like 4 power wheelchairs and then the giant soccer balls that come with it, and allow folks from the community to come and actually try out what it would be like to play these games and to be, involved in the same light as someone who would have a disability. It's super fun and it's very educational. If you've never like tried to play wheelchair basketball, it really opens your eyes to some things. So Dr. V Jones, as we call her, really exposes us to some things.
Yeah, at our institution, our program director, he identifies as part of the LGBTQ community, which I think is great, and that adds to the diversity within our program. He makes, he also places a great emphasis on wanting to make sure that we are as diverse as possible, not just with the residents that we're interacting with, but also the facilities that we get to train at and the patient population that we get to interact with. So he was a great addition to our program not too long ago, and we're very grateful to have him. And then our department chair is Dr. Monica Verduzco Gutierrez, who is also very involved in DEI research and has also made that a huge mission of hers for our program to make sure that that's something that we place great emphasis in. And I can see it in, the initiatives that we have within our program, and then also the faculty that she's hired and the things that we're doing here. She's also very involved with like long COVID patients and patients with disabilities, as we all are, with rehab. And so that's something has been highlighted, and it's a theme that kind of gets brought up whenever we have our didactic series.
Yeah, I would just echo a lot of what Luis and Raquel was saying. I think, all our attendings at Rush are from a different like walk of life. And they did a pretty good job with each resident class just coming from a different background, and just grows the all learn from each other. But yeah, a lot of just echoing what Luis and Raquel said.
Yeah, I would say that most of our attendings and teaching faculty are all from different parts of like the world. Some of them completed like 2 residencies, and I think it kind of just shows like how much they care about like learning and teaching. And I think that's important. But I think when I was like looking at like programs in general, I would always look at the faculty and see like where they're from. And I think that's like a big important thing to look into for students in the future as well. But yeah, kind of pretty much what everybody else has said. Think it's a good mix just throughout like my attendings and also my co-interns as well. So it's been really nice to learn from everybody else.
Okay, perfect. Very good. I mean, it's very nice to hear that y'all have those initiatives and people that y'all can look up to and have that representation within the leadership. I know that's really important to us as students and future positions. So more specifically in terms of that, I guess choosing a residency is definitely about finding a place where we can, have that representation and feel like we can thrive there. What qualities or factors influenced your choice of program, and how did you sense that your personality would fit in within the culture?
Yeah, but I can start for this one. I remember I specifically asked about DEI initiatives and how often they were happening. And I think the key was like how, and that was like my gauge for how committed the program was. But like, yeah, every couple months they would host something to kind of bring people from different backgrounds together. And then also asking past residence experiences, like asking for like maybe religious holidays off or in terms of openness in that realm. Um, but then also just how many community service projects there are um, that like one can get involved in, just kind of expose yourself to like the Chicago community. But kind of I think the key would be just asking very specific questions that result in specific answers that were there's been initiatives, projects, organizations already established and they're doing something.
I think for me, just looking into programs in general, I think a large part of that was like patient population and seeing like what kind of demographics are around the area. Um, I think like, the more like urban you are, or like even like suburban environments, like you can have like a good mix, and it allows you to not just see like different pathologies, but like different groups of people as well. So that was a big thing I took into consideration. And in general, like when I was, I kind of talked about it before, but when I was looking at programs, I would just look through the roster of like the faculty and the previous class of residents and just see like, do they take like a good diverse mix? Like, what kind of candidates do they traditionally take? I think that's a big part to look into as well. So I think those were the two biggest things. I think specific questions wise, I think I would just like ask if they do any of those like community outreach events. I think that's like a big part too. And yeah, just like cultural awareness. I think that's a big thing, like those holidays that I mentioned before. I think that was a really nice initiative that some programs had. So just asking about those specific things were great.
Yeah, I think for me, when I was interviewing, the best resource that I had, as Chandan mentioned, was the residents. So, most programs, when you interview, you'll have the opportunity in some capacity to interact with the residents, whether that's on interview day or like on a pre-interview social or post-interview social, whatever they may do. And so approaching them and asking them these kinds of questions was very important to me because I feel like they would be the most honest out of everyone. So I thought that was very important. I felt like I would get some good answers from them in that regard. And then from the faculty themselves and from the people that I interviewed with, I think it's very important just first of all to ask these kinds of questions. I know unfortunately in some settings there might still be some stigma related with asking questions about DEI. You don't want to like, I don't know, people still think that way in some places, but you want to make sure that you feel comfortable asking these kinds of questions because this is something that's very important to you. And if you don't feel comfortable asking these kinds of questions, or you feel like you might be judged for asking these kinds of questions at a program, then that's probably not a program where you want to be, because likely you will not be able to thrive in that setting. So you should be feeling confident and comfortable having these important discussions because that's something that can make or break where you are in residency and the kind of things that you do. And the question that I like to ask the faculty that I interview with was in regards to not only what kind of events did they have already in place, but how welcoming were they to, or how flexible were they to new things, like organizing new events, or if a resident was interested in creating or doing something new, how much support were they able to receive from the faculty, the program director, the department chair, whoever it may be, to see those things come to light and make those events possible? Because I think that's very important for you guys. If y'all have ideas of things that you want to incorporate during your time in residency to make the spaces that you're at more diverse and to educate people, then I think that's wonderful. Kind of like my example is that I'm very passionate about medical Spanish. I was part of the medical Spanish, the PM&R Scholars Medical Spanish Network. And so I spoke with my program about incorporating some of those lectures into our didactics. So making it basically mandatory for all of our residents to take part in these sessions and learn from them. And they were very open to that, very welcoming. And we were able to weave them into our didactic series, which I thought was very wonderful. And that's kind of what you want to see from the programs.
I'll just second what Luis said. My big thing was if I want to come in and I want to incorporate something that I see is wrong right now, how fast could that happen and how much support would I have? So I think it's super important to know like who you are and how you want to go through your residency, and then find a residency that's willing to say, okay, yeah, like we can work with that and we will stand behind you with whatever changes you want to make.
Great, thanks for sharing. Do y'all remember like any specific questions that you did ask during those interviews, and any specific ways you worded that, so that as we approach interviews, we can take that with us?
I can take this one. I think one of the biggest things I think I asked was just resources available for a lot of people from like either like a mental health standpoint, or just people who have come from like marginalized communities. I think that's a big thing to ask for. Sometimes there's always like a stigma. I don't know why when you ask for like certain things, it makes it seem like a little bit uncomfortable. But you do have to talk about it and ask about that. So I did ask for any like type of like resources are available in terms of like that standpoint. And I think as far as anything else like observations for like DEI specific initiatives, I kind of just asked like how diverse is like the leadership in particular, and like is there an active effort to like recruit more leaders that are like I guess like diverse in like the field. I think that was just like an important thing to just ask for and kind of see them kind of take those initiatives.
Awesome. Thanks for giving us that example. So switching gears in terms of like patient care, does your residency program integrate DEIA topics into the actual educational curriculum, in terms of like how you treat patients of different backgrounds?
So here at UT San Antonio, that's something that we're working on and trying to improve. Like I said, we've implemented now the medical Spanish series. Given that we're in San Antonio, there's a large population of Spanish-speaking patients that we see in our hospital. And so incorporating that into our didactic series. But then we also have a wellness chief as part of our like chiefs. And they also do lectures into that are put in our didactics. And part of the topics that they cover is like mental health, diversity, equity, and inclusion, and things like that. And I believe that we're working on doing, so we do like journal club as part, I'm sure the other residency programs do as well. And so they wanted to explore some of like the diversity topics journal club, which I thought was a pretty neat idea.
All right, perfect. Thank you so much for that. It's nice to hear that y'all are able to, you know, advocate for that and have that as an option for you, and I guess that they're receptive to your feedback. So moving from that, I guess from your experience, how do those DEI initiatives or things that you're passionate about impact your patient care and your growth as a resident? And could you share a moment where you felt like you felt this impact?
Sorry, could you repeat that question one more time?
Yeah, sorry, I realized it was kind of a mouthful. So we just talked about, I guess, how your residency programs are able to integrate the DEI topics into the educational curriculum in terms of approaching patients of different backgrounds. So I guess with what you've learned and stuff like that, how do you feel like that has improved the growth of you as a physician, or in terms of just patient care in general?
Yeah, I can answer this one. I think in Chicago and especially at Rush, we see literally patients from all walks of life. And I think the most common one is like with blood transfusions, like certain individuals not being kind of open to receiving certain blood products. But I think another one I've like noticed more in the past year, especially starting PGY2 and PM&R, is kind of individuals from like individualistic societies and collectivist societies, you could say. And then kind of selecting acute rehab that are actually closer to home. And so as I'm like kind of initially on consult, like seeing the patients, and kind of getting a sense of like kind of their backgrounds, more often ask than like where they're living, and then like providing more resources for rehabs closer to there than I think maybe otherwise than individuals with more individualistic backgrounds. But I would say that's one for me.
Based on how my program usually teaches things, it's more so, it's very objective in that you're looking at if the patient is doing well in therapy and if they're progressing like in terms of inpatient work to get, home from the hospital. And recently I had a case where a patient was very difficult, very emotional. There was some a psych background with maybe some like a bipolar issue, and so like mood issues were something going on. And so whenever there's all of that is involved, it makes the patient a little less believable. And then the time came where it was time to discharge, right? It was time for them to leave the inpatient unit. And me and my attending stepped back and we looked at therapy's notes, we looked at occupational therapy's notes, we looked at the patient and asked how they felt about things, and they just didn't improve, right? It was like, okay, even though they've been here, they've been through therapy, they've done all of this, I actually don't think they've gotten any better. And then we asked the patient, and the patient said, I don't really think I've gotten any better either. And we ended up sending them back to the hospital. And it turned out that they got an MRI of their low back and there was an abscess back there. And that was like preventing them from, that's where the pain was coming from. That's where all the aching was coming from. And the subjective chills that never came up in the labs was coming from. So it was more of I don't know, you learn to listen to patients. You don't necessarily go off the numbers. You just because of how things, I don't know, seem based on your point of view as like a physician or just as a person dealing with other people in like what's a service industry. If you really listen to folks, you can really help some people. It actually does shine through, especially in rehab.
A recent example that I had, so I just switched services a couple weeks ago, and I'm back on the inpatient side. And so the resident that was before me, they handed off their patients to me. I said, great, thank you. I'll go and start seeing my patients. And like I said, here in our hospital, we have a large population of Spanish-speaking patients. So about half of my panel was Spanish-speaking, which I have no issues with. That's my native tongue. So I was happy to like speak with them in their native language. So when talking about kind of Raquel's point about we're taught to listen to these patients, but having a language barrier can also often like lead to problems with patients just reporting issues in general. And so that was what I encountered. My co-resident, he handed off these patients, and there was one in particular that he was just like, oh yeah, they're fine. Everything's great. No complaints. They're good. And I said, okay, cool. So then the next day I went and spoke with the patient. I introduced myself. I told them I was going to be the physician taking care of them. And of course, I spoke to them in Spanish. And then there was like a sigh of like relief that I had immediately when I started speaking to the patient in Spanish. But then it was what followed that was kind of like eye-opening, because then now that he knew that I was Spanish, he got more comfortable. And then they started sharing like some of the issues, things that had been bothering them that they didn't necessarily bring up in the past, just because they thought it would be like too difficult to explain. They didn't really want to get into it. Didn't know how to say it in English. We do use the translators, but sometimes it's hard for things to things get lost in translation. And so they just sucked it up, is what they said to me. And so, that's part of the reason why I make a big effort to not only help not only try to see as many Spanish-speaking patients as I can, but also with my colleagues, if I have a minute and they have any questions, or if they want to go talk to the patient about an important topic, I like to just, if I have the time, volunteer to go with them. That way I can serve as like an in-person interpreter and make sure that all their questions get answered. Because sometimes, on a discharge day, I've seen it where the resident will go in there and say like, okay, you're going home, here are your medications, here's your follow-ups, any questions? And they just kind of like shake their head no, and they were like, okay, good, next. And I kind of just look at them and I can see that they're a little confused. And I'm like, hey, like, what's going on? What, like, hey, I don't really know what this medication is for, but they're just telling me to take it. And so it's just like, I've seen how that kind of helps patient care, and not just in my language, right? We're very fortunate right now in our service. I speak Spanish, and then one of my co-residents, she speaks Farsi. And then we had I got a Farsi patient in our unit, and I was like, oh my God, now I feel like this. So this is what everyone feels all the time. And so she was able to help me a lot. So it's great to be able to communicate with the patient in the language that they prefer, because it can really do affect outcomes and just like their stay in the inpatient setting.
Great, thanks for sharing those specific experiences. So a more difficult topic. Have y'all ever experienced a difficult patient encounter where maybe you yourself experienced discrimination, and how were you able to deal with it? Really just like, how do you advocate for yourself, and not just, you know, discrimination for gender, just any type of thing.
Sure. I underwent an event when I was working at the VA in my intern year. It was nighttime, like we were working nights, so there was actually an all-female staff. It was me and then my senior, who was also a woman, and then all of the nurses were all women. And we just so happened to get a veteran who only wanted male doctors to see him. And he was using some foul language with us, and we actually took a step back, took a deep breath, listened to what the nurses were saying, because they alerted us before we even went in the room to try to see this person it was on an admission, so no one had actually seen him yet. And we tried to reason with him. You know, we said, hey, we're here to help you. We're here to make sure you feel good. We evaluated him very quickly for like mental changes, right? Do you know why you're here? Do you know where you are? Do you know what's going on? He knew all of that stuff. So it wasn't like a dementia kind of state, or he wasn't altered. And then once his language got to be threatening, we were able to step in and say, okay, no, you know, we can't put ourselves in danger. We can't put the other staff in danger. And we were able to step back and call security and have this patient removed at that time. And I think it's really important to know where the line is as a physician, and you know how far patients can get, or how close patients can get to that line, and where you need to stop and say, okay, this is actually not safe for us. Because even though we're taught to want to help people, you can't put yourself at risk, especially not in your place of work, right? So yeah.
I thankfully haven't had like too many experiences where I've personally felt the discrimination. But I do have like, I guess like more like micro expressions, like microaggressions that I think are more noticeable, particularly because I tend to wear like bright color scrubs or things like that. And I think just like being like a female, especially sometimes when I wear glasses, I look really young. And the patients will oftentimes like address me as like the nurse, or I'll start explaining like, you know, what's going on like in the middle of an admission or something. And they'll be like, oh, okay, yeah, when's the doctor coming in or whatever. And I was like, oh no, like that's me. And I think like, I don't think they mean any like harm by it. I think it's just more so one of those like, I guess stereotypes that you just have to consistently break. And it's unfortunately like part of the training that you go through. But those are just some of like the experiences that I've had.
Yeah, I would say like overt racism from a couple of patients, but they've been like altered. So I tried to give people grace and then just not take it too personal and let it just kind of roll off my shoulder and say, you know, they're not in their senses right now. So I'm just not gonna go there. I know I try to, you know, take comfort in, I know who I am, I know the kind of person I am. So I try not to let it get too deep. I've had microaggressions. I've had a couple, but obviously I have privilege as a male that often, I'm on the taller side, on the bigger side. I have 2 kids, so my eyes are like, I'm always look tired, so people think I'm older, I guess. So I don't often get confused for a nurse. I've been confused for a janitor a couple times. I'm very good about, I like to, if I were a patient, I would like things to stay clean or try to help as much as, like, for the team to help me as much as they can. So I'm not above like going and grabbing a blanket for someone, or like picking up, like if they left their lunch tray, like moving it or whatever, if it's on their way. And so because of that, I've been confused as a janitor. And I try to just be like, it's fine. I'm doing these things. Maybe that's why I try not to not take it too seriously. I have noticed a lot with my female colleagues here at our program. I've seen it here at our hospital, and then also at the VA. I see it all the time where they get referred to as nurses. So I made a point to always refer to them as like, they're your colleagues. So, oh yeah, this friend, that friend, first name, first name, first name. But the moment we walk into the room, they're like doctor, whoever it is, because I want the patients to like associate, this is your doctor, this is the physician, this is the title, so that we minimize those microaggressions directed towards them. And so I try my best to address them as such when the patients are around. That way there isn't any confusion, or we try to minimize it as much as we can.
Yeah, and for me, I think I fortunately haven't had too many poor experiences, but I think one recently was I think actually with medical students, patient didn't want like any medical students in the room. And then I had an attending, and she actually sent an article about it to me recently. And it was about like when these microaggressions happen and these aggressions, to kind of just call it out that like, hey, this is in this situation, like this is a teaching hospital, and not okay to kind of say those type of things. And that, we're all trying to take care of you, and to then kind of say those things and then come back in 15, 20 minutes. It's exactly what we did. And the patient was like, okay, yeah, medical students are cool, come through. Not exactly in those terms, but they were like a lot more open with having them there. But I think the kind of important lesson with all of that is when those things happen, and especially in medicine, where I think we're always like on fence and don't want to step on each other's toes, that like it's okay to kind of stand up for yourself, for your team, and to just, politely and in a respectful way, just call it out. Because it's not okay at the end of the day. And I think we need to do more of that, just as like a medicine society.
Yeah, I definitely agree. And I think we're very lucky to hear about y'all's experience and your perspective. So thank you all for sharing your experience with that in particular. I think even as medical students, we experience that like for some reason it's a very complex issue as a female medical student when you tell them you're in medical school and they just can't understand that you're not in nursing school. So definitely I've gone through that, but nice to hear how y'all deal with that, and how y'all just keep it pushing. So that's great. So I think patients can also be subjected to bias and discrimination from caregivers and maybe our colleagues. Can you share your experience with this and how you approach advocating for them?
So I would say there's a lot of like mistrust with the medical system coming from minority groups, rightfully so, because of things that have been done in the past to these marginalized groups. And so I think this is where it's very important, to kind of be the face of medicine in a way. So I've encountered multiple patients and family members who were skeptical about the treatments and things that we were suggesting to the patients, sometimes thinking we could be doing more harm than good. And so I think that's where it's really important to, the education piece and the cultural competency piece of like understanding that these people are not, that like the patients and their family members are not being rude and disrespectful or trying to undermine you or say that you don't have any expertise or whatever. It's just the fact of things have been done in the past to these groups that they have the right to feel a certain way about receiving treatments and questioning what is being done. So my best advice for that has always been just be very transparent and educate as much as you can. I always try to do that with my patients and, explain why we're adding a new medication, why we're doing this instead of that, what we're thinking, and answering their questions and concerns if they have any. And it's always a partnership. So saying, look, if I were in your position, this is what I think I would do, or like if I had a family member that was in this position, this is what we're recommending this. So I think that's a very important piece, to always be very open and honest and have those discussions with the patients and their families, because that's a reality. Sometimes there's some distrust, mistrust, and so that's the best that you can do.
Just going off of what Luis was saying, on top of being open and transparent, I would really recommend making sure you take your ego out of it. You get, and by you, I mean like medical students, residents, attendings. You've been doing this for a long time. You've studied a lot. You've passed a lot of tests. And then in comes a patient who came in for a problem and then doesn't necessarily off top want to listen to you immediately, even though you're giving your suggestions. I think it's really good that when you come into these situations to take a step back and say, I'm actually here to help this person, right? I'm not here to force anything on them. I'm not here to hold them down and make them take this medication or, do this rehab or, anything like that. So I think getting down to their level, right? Making sure that y'all are seeing eye to eye on things and removing your ego from the situation can allow for you both to communicate pretty openly.
Well, we thank you panelists for all of your insights. This has been great to just share community with you. We're almost out of time here, so we just want to carve out some time to ask the audience if they have any specific questions. They can feel free to unmute or use the chat to submit questions.
I see one on the chat from Danielle. I think I briefly mentioned it whenever we were talking about it earlier. I think as far as gauging support for DEIA initiatives whenever you're interviewing, again, it's all about being true. And this is just like a general recommendation, not just specific to DEI, but anything that you're very passionate about. You shouldn't have to hide, minimize change whenever you're interviewed at a program. You want to make sure that you go to a program where you feel supported for who you are and the things that you care about. So you shouldn't have to tiptoe around certain topics whenever you discuss them with your interviewers. And there's a specific like follow-up question talking about states like in Texas, like I talked about, they changed names, rebranding, rewarding. The reality is in these big cities and in these institutions, for the most part, those initiatives are still very well supported. And so there's just a change to what they're called maybe. So you might have to ask around to figure out what the new name for the DEI office is, but they should still be around. And you should still be able to find the kind of things that they do. So I wouldn't try to like change your CV, your application, or the way you talk about things, especially if DEI is something that you're very passionate about and you want to make sure that you feel supported on that topic.
We had some submitted questions. So one of them was, tell us about a situation in your program where a concern was brought forth by the residents and how did administration address the issue?
I have one. So we had a recently. So we do here at our program. We typically do a town hall meeting with our program director about once a month, where we kind of run through everything, make sure any questions, comments, concerns get addressed by him during those meetings. And so recently there was a concern about one of the residents felt like maybe they weren't getting like enough supervision when she was performing some procedures at some times. And so she just wanted to make sure that was something that was addressed. So as with everything else, when that's reported, it kind of escalates. It goes up the chain to figure out who needs to know about these problems and then needs to be addressed so that whatever issue or concern the resident has gets addressed. And so that's exactly what happened. They talked about it. They spoke with the attending and what the issue was with like scheduling, and they were able to come to like an agreement. And then what I really appreciated and liked was that at the follow-up, at the following town hall, it was kind of addressed to close the loop, which was nice.
Sounds good. Thank you so much, Dr. Valdez, for sharing that with us. We had one more question in the chat. Are there any common mistakes that you see students make related to DEI? For example, overestimating the amount of Spanish you speak and not using an interpreter, leading to poor communication.
I can take this one. I personally haven't like interacted with students and when they're like history taking or anything like that. But I think like in general, to make sure you avoid like any mistakes, it's just knowing like what level of Spanish, I guess in this example, you are comfortable with. Like, what is your like comfort level? Are you more so just like certain terms, or is it just more so or you can like converse and get a good history and physical and things like that. So like for me personally, like I'm comfortable with like asking like certain medications, doing a physical exam, getting history, just like basic, like, when I'm like admitting patients or checking in on them. But when it gets to be like a little bit more technical, right, like more like medical, like diagnoses, things like that, then I would feel more comfortable just having a translator there, because I don't want things to be more confusing for them. Because I don't feel that comfortable in my Spanish to be able to like speak like someone who's fluid, because I'm not. So I think just knowing like where you stand on that and like your own personal comfort level is a big thing. And I think a way to just also like get better at it is like when you do have the translator there, I think like trying to like translate it like yourself when they're talking and like figure out like what you would say in Spanish. I think that kind of helps too, because just you can pick up like certain words, like, how to do like ultrasound or like CT or like x-rays, like things like that. Like I think you can pick up words and it'll make you go far as you progress through your training.
Alrighty, thank you all so much. We'll just go ahead and close with that question in the interest of time. That hour definitely went by so fast, but thank you to all of our panelists for such an engaging and insightful discussion. I think we speak for everybody when I say that we're very inspired by all four of you. We hope this session provided some valuable perspectives on DEIA and PM&R specifically, and specific to the residency programs that you all are at. These types of conversations are very important, and we are so happy to have had the chance to learn from all of you this evening. And we also encourage you all to stay connected with AOCPMR and Representation in Rehab. So please reach out to any of the panelists or Vanessa and I if you have any questions in that regard. If there's anything else anybody would like to add, please do. But if not, y'all have a great evening, and thank you all so much.
Thank you for organizing this and having us.
Definitely our honor.
Yeah, thanks for organizing everything and coordinating it all.
Yeah,
Thank
thanks
you.
Yeah, thank you all so much. We appreciate you. This was fun. No pages. Whoa, can we just?
I know.
Can we just?
Goodbye.
Wow.
Yeah.
Now, of course, now that I said that, it's just everything's gonna go off right
It's
now.
gonna
But
blow up, right?
it's okay. It's okay.
Okay.
I can take it now.
No, that was super lucky. Thank you so much again.
Yeah, we appreciate y'all's time.
Yep.
Yeah,
Thanks for
thank
having
you.
us all. Thank you.
Have a